Hello and welcome, everyone. Welcome to today's topic. Today it's going to be about GERD, gastroesophageal reflux disease. This is a very simple topic. There can be a lot of people complaining of like simple things like heartburn and stuff like that. So this can possibly be related to gastroesophageal reflux disease, and this is also called acid reflux disease as well. So let's get started. The pathophysiology for this disease is a relaxed lower esophageal sphincter. So that is the reason why a lot of the acid secretions go back up into the esophagus and they cause discomfort because the esophagus was not built to contain these acid secretions. It is just a passageway for food to go into the stomach. So it's not necessarily doesn't have the strong lining that the stomach does itself. So that's why there is a sphincter there that doesn't allow the acid secretions to go back up into the esophagus. And if it does, it can cause really bad damage into the esophagus. It can create holes, or in the future, it can also create esophageal cancer. So this is something that you can easily control just to avoid having further complications of this disease in the future. So the sphincter usually is closed, but in this disease, the sphincter is usually opened and relaxed, and it allows secretions to go back up into the esophagus. Signs and symptoms of this disease is dyspepsia, belching, nighttime coughing, dysphagia, epigastric pain, regurgitation, heartburn, and globus. Globus is a feeling or sensation of the lump in your throat. For this type of disease, the one thing that you want to be able to look out for is the nighttime coughing. That's something that's going to be specific, and it should jump out to you and say, once you hear someone complain of nighttime coughing, you're going to automatically suspect, oh, this person might have GERD. So that's one thing that I might bring about attention to, is the nighttime coughing, because that is something that is very specific to this disease, along with heartburn and epigastric pain, of course. The diagnosis for this is a referral to a GI to determine the underlying cause, and usually the GI will perform what is called an endoscopy, and they will put a camera down the client's throat to see what might be the cause of this disease and the discomfort that it might create in the client. Treatment for this disease includes antacids, H2 receptor blockers, proton pump inhibitors, and lastly is surgery. But usually that's the last resort. I mean, typically for anything, it's usually the last resort, is surgery. So antacids include milk of magnesium, Tums, Maalox. H2 receptors are cimetidine, famotidine, and proton pump inhibitors is esomeprazole, lansoprazole, and omeprazole. And for proton pump inhibitors, you might want to think the prazole suffix. That's something that all the proton pump inhibitors might have, as the suffix is the prazole. And then some lifestyle changes that the client can do to help with the gastroesophageal reflux disease is to quit smoking. Smoking causes inflammation throughout the entire body. It doesn't just necessarily damage the lungs. It is kind of like a direct contact to the lungs because it's damaging the lungs, but the smoking really does create inflammation throughout the whole entire body, so it causes inflammation in the stomach. So quitting smoking will help with the inflammation. And a healthy weight, you might want to sustain a healthy weight to be able to control this, because like for example, if you do have a person who is constantly eating, or they're constantly eating large meals, when they do eat, they have an increase of acid secretions within their stomach, so they might want to try to get into a healthy weight to start reducing the meals that they eat, and which in turn reduces the acid secretions within their stomach. And relaxing, because stress also causes stress does a lot of harmful effects in your body, and this is one of the things that it does, is it has an increase of acid secretions when you're stressed out and when you're not fully yourself and you're not relaxed. And that's another lifestyle change that you might want to consider. And avoid triggers such as like coffee, greasy foods, Um, what else? Spicy foods. And also wearing comfortable clothes, because if you're wearing too tight fitting clothes, it might squeeze you, and then in turn it'll put the acid secretions into your esophagus. And then small frequent meals, because again with the acid secretions, there won't be as much when you're having a large meal. And then wait about 2 hours before going to bed, because if you eat and then lay down, of course, if you have a relaxed sphincter, and then the food content is just gonna go back into your esophagus. So to avoid that, just wait about 2 hours before going to bed, and then raise your head of the bed. It's not necessarily just raise your bed like the height off the floor or something like that. It's basically the where you lay down. Some beds can really accommodate to that, where you're able to raise the head and not the entire bed, because I don't think that would really benefit you. But if you raise your bed, it will also help keep the secretions down. So thank you for watching, and don't forget to subscribe for more videos. Enjoy the rest of your day.